My name is Sarah, and this is my story. A story of how my life experiences and social circumstances have shaped my health. Meet my dad. He left when I was 5, and I never really got to know him. This is my mom. She works 2 jobs, and when she gets home, she is exhausted. I never spend that much time with her either. This is where my mom and I live. That apartment in the bottom left, that's ours. I play outside as much as I can, although I don't have many other kids to play with, and the waste from the mill has polluted the nearby river. My mom doesn't have a car, so I take the bus to school. I don't like school that much because I'm not a great reader. My mom never had the time to teach me to read as a kid, and we never had books lying around. My poor reading and writing skills led me to receive bad grades. I quit school when I was 16 because I had to help my mom make money. I didn't like school that much anyways. I started working at a fast food restaurant chain near my house, making $12 per hour. I was eating the fast food served at my restaurant on the regular. It was just so cheap and easy. My weight increased and my confidence decreased. To cope with my financial stresses, weight gain, and low self-worth, I started drinking. At first it was just a couple glasses of wine a day, then it turned into a couple of bottles. Then I started smoking. As my physical health continued to decline, so did my mental health. As much as I wanted to deny it, I was suffering from extreme anxiety and major depression. Depression is not equally distributed among advantaged and disadvantaged populations. In fact, depression is influenced by a variety of social determinants, including early childhood development, educational attainment, gender differentials, material disadvantage, unemployment, and social exclusion. 1 in 8 Canadians will experience symptoms of depression at some point in their lifetime. Depression is twice as common in women in comparison to men. Parental educational attainment is associated with childhood development. Take, for example, the 30 million word gap. By age 4, the average child in a welfare family might have 30 million fewer words of cumulative experience than the average child in a professional family. What's more, anxiety and depression are twice as common in groups of low educational attainment relative to their high educational attainment counterparts. Gender is also critical in that it determines social position, status, and treatment in a society. These factors influence the differential power men and women have over their socioeconomic status, educational attainment, income, and housing. Lack of employment is associated with mental health problems that include depression, anxiety, and increased suicide rates. Employment is also directly associated with income. Depression is 2.3 times higher in lowest income groups in comparison to highest income groups in Canada. Employment, income, and socioeconomic status are related to housing. Living in unsafe, unaffordable, or insecure housing increases the risk of many health problems including depression and anxiety. Social exclusion and neighborhood-level disadvantage results in limited opportunities, as well as lack of social integration and cohesion. Social exclusion creates a sense of powerlessness, hopelessness, and depression that further diminish the possibilities of inclusion in society. Sarah's story was just one example of how social determinants can influence the outcome of depression, and highlights the importance of public health professionals addressing this complex network of factors affecting health.